So I have a previous video that I actually show class 5 fillings being completed on a patient. Today I'm going to talk about the same concepts but with a little bit more emphasis on the actual technique so that you can see how it's done. A lot of new doctors that I see kind of fiddle around with the class 5s and make it a much harder procedure than it actually is. So I'm going to kind of show you my hand movements that I have found that make this super simple and also protect the patient's enamel and make this a very predictable procedure, especially since it's something that we find so common in people's mouths. So the instruments that we typically use with class 5 really are about the material that we're going to use, which is resin modified glass ionomer. In my instance, I like to use the Fuji products or the GC America products because with one delivery mechanism, I can do buildups, we can use the triage for sealant, and we can use the Fuji Plus for our crown cementation. That way, our assistants only have to know one delivery method for multiple applications. The other consideration that I like with the resin modified glass ionomer is when a patient is starting to get caries on the surface of their tooth near the cheek, my primary concern is mitigating future caries. And so even when a younger teenager comes in and we have that caries on the surface of their front tooth, a lot of times doctors are considering using a pure resin composite because of what they feel is an aesthetic demand. But for me, I am more concerned about the anti-caries properties of the Fuji or the Fuji 2LC or the resin modified glass ionomer, because I would much rather see if we can get that caries arrested and protected, and then if there is a future aesthetic demand, I can always go in and replace the resin modified glass ionomer with a resin composite. How many times have I actually replaced that? Almost never, because unfortunately very few patients become more compliant after getting dentistry done. Unfortunately, just the nature of compliance. So the instruments that we're going to be using are obviously the cotton pliers, the mirror. I will use an Explorer occasionally if I need to clean up underneath the margin. And the Explorer is also used to make sure that you have no overhang when you rub from the surface of the tooth, the root surface of the tooth, up towards the occlusal. The main instrument that we're going to use is the plastic instrument, or sometimes people will call this the flat. Obviously, we'll be using cotton rolls, and I know that Fuji 2LC comes with a cavity conditioner. I simply just use my 37% phosphoric acid. We have the delivery gun, and then obviously we have the Fuji 2LC. So I always consider that we have, and kind of an older term for resin composite is packable composite. We also have flowable composite. And so after having worked with resin modified glass ionomer, I like to call this wipeable, in the fact that it's not really able to be packed very well, because if you try packing it when you try to draw away, it can pull the material out of your cavity prep. And it's not really too flowable either, in that it will go into small spaces, but it needs additional pressure in order for it to have a perfect adaptation to every corner of your cavity prep. We have used this product so much that we also know that after this comes out of the amalgamator, that the assistant will use 3 clicks of the extruder gun before the material starts coming out of the tip. And so we train our assistants to give it 3 good clicks, and then they hand it to the doctor, and then the doctor is the one, when they do the 4th click, it's already starting to extrude. It also, you'll see when we do this, that when the assistant does their 3 clicks, they're gonna do their 3 clicks into the palm of their hand, so that if any does extrude out by accident, it will land into the assistant's hand versus ending up on the floor of your operatory and making your operatory look dirtier. So let's go over an example of applying Fuji 2LC, resin modified glass ionomer, or a wipeable resin modified glass ionomer into a class 5 filling. I have taken this Typodont and emphasized exactly where this cavity is using the marker so that you can see it better on the Typodont. Okay, so I have selected all of the burrs that I would ever use for a class 5 filling. Now, as you've seen in previous videos, I'm going to use a total of 10 burrs for everything that I do in all of dentistry. And in this case, I have separated it into the 4 preparation burrs that I could possibly use, which would be the egg-shaped, the 337, or excuse me, 337, the 6 round, and the round diamond red striped. I've also have these 2 as my finishing burrs, which would be the flame shaped and the Arkansas stone. So these are all of the burrs that I would ever use. Now, 90% of the time, I'm going to be using for abfractions or non-carious cervical lesions, I'm going to be using the egg-shaped for the preparation, as I'm not taking off any tooth structure. I'm just simply roughening up the sclerotic dentin so that I have better access to the dentinal tubules. If there are caries, then I will use these 3 burrs. You'll see a lot of times when you're getting into the buccal of your second molars on the mandible that you'll have to use these diamonds to get a lot deeper and closer to getting all of that carious tissue out. And then when I'm going to finish, it's mostly going to be the flame-shaped burr, and then possibly a little bit of finishing with the Arkansas stone. So obviously, first step after preparing, we are going to fill the cavity with our phosphoric acid. And then we are going to indicate to our assistant by nodding our head that we're ready, and that means that they will engage the high-speed suction. They will suction out the bolus of the phosphoric acid, and then after that bolus is removed, then we'll come in and do our rinse. Now, I like to keep my etch on the tooth for 10 seconds, and then I also like to rinse for 10 seconds, and then I'll go ahead and dry. I will then place the cotton roll, and like I said in previous videos, I will go ahead and roll that cotton roll underneath the tongue on the mandible, and I will put that cotton roll on the cheek on the maxilla. Okay, so with assistants, sometimes they don't know how to use this. Now, the best thing to do is when I'm loading this, and I will show you, when you load this, the easiest way to unload it is to simply pull your finger through here, okay? A lot of times assistants will kind of mess with that. And then the easiest way to break the seal here is to just press it here on the table. Another secret for assistants is making sure that you click this button first so that you don't fumble around when it's ready to go. So the setting on our amalgamator is always going to be 10 seconds on high. So let's watch the entire sequence. I'll go ahead and press the button, breaking the seal. I'll go ahead and load it. and then we'll go ahead and start. Once that's done, I'm gonna go ahead and open here, and like I said, easiest way is to just come in here and pull it back. And then I'm gonna always want this pointed straight down. So usually we're gonna put our thumb here, and then we're gonna do 1, 2, 3. You're gonna see that it comes to the tip, but not through the tip. Another important thing is to check your amalgamator. Sometimes it will be off to one side, and if you put the tip in wrong, it will bang up on the side and make a terrible noise. This one here, we've now gone to ones that are equidistant between the shaker and the plastic, so we don't have to worry about that. But make sure that you look at your own amalgamator. So obviously the doctor is going to put their filter on their light, and then you're gonna see how I am just going to let this overflow just a slight bit over the cavity prep, and this is the most magical thing right here. So when I am doing this, I am going to wipe, okay? And then you have an option here where you can wipe here, okay? So like I said, a lot of new doctors are kind of doing this motion, and that's gonna cause what I call lemon meringue pie, where you're gonna have these little peaks, versus a continuous motion of wiping. A continuous motion of wiping, okay? And I'm always gonna usually start on the mid buccal and do one wipe to the distal, and then one wipe to the mesial, and potentially a wipe here, okay? And then we'll go ahead and do our cure. So we'll go ahead and do our cure. Now this particular light is rated for a 3-second cure. Usually I like to standardize on 10 seconds for everything. So a 10-second etch, a 10-second rinse, and a 10-second cure. So after removing the cotton roll, I am going to use my flame shape burr, and I am going to underwater and I'm not gonna be going full speed. I'm gonna lightly come here and just take off any excess in that same sweeping motion, just like this. Then I'm going to check with my Explorer that there are no overhangs. The nice thing about the Fuji product or the resin modified glass ionomer, sometimes you're simply able to flick off any flash with the Explorer. One of the most important things on class 5s is, as caries gets closer to that gingival margin, you need to, and I've left this purposefully a little bit super gingival, is you need to check that there's no gingival overhangs, because we don't want to cause gingivitis or periodontitis because of our cavity filling. So every single time I'm going to come here underneath the gum, and I'm going to wipe straight occlusally to make sure that there is no overhangs. One of the super important points is trying to not cause additional sensitivity for the patient. So during the prep, I'm going to be very super conservative, if not only using etch in certain instances. And then when I come in to do the final prep, I will use the Arkansas stone occasionally to make sure that it's absolutely smooth. So in summary, class 5 fillings are very common, and they manifest in a lot of different ways, from deep caries, usually on the second molars of the upper and lower jaw, maxilla and the mandible. And they can be super shallow, usually non-carious cervical lesions on the anterior, but mostly the premolars. So be very cognizant on looking at those areas. There's been a lot of occasions where if I'm doing an exam quickly, I might miss those surfaces on the maxilla. So make sure that you're looking there. When you're doing your preparation, make sure you're using the right burr and you're being very conservative to not cause additional sensitivity. The other thing too is making sure that you're using those burrs that I had explained earlier, and then using that wiping technique to make sure that you don't have any excess and it's done very predictable, and using the right material. When I get into trying to use a flowable or a packable composite, I usually, if I have an overhang, it's going to be very, very difficult to address post-cure versus the resin modified glass ionomer, which has those anti-caries properties and has a very good aesthetic in the posterior and even in the anterior when you have large caries on the facials, especially after potentially orthodontic braces. And then finally making sure that you check for no overhangs and you address that with either the flame shaped burr or the Arkansas stone.